Hi, my name is Nimmi Ramanujam, and I am a professor of global health and biomedical engineering at Duke University. And I also direct the Center for Global Women's Health Technologies. And with me is Marley Krieger, who is the executive director for the Center for Global Women's Health Technologies. And both of us today are excited to interview two experts who are going to talk about their experiences with COVID-19 and also how it relates to cancer. Julie Torode is from UICC. UICC is the Union for International Cancer Control, and this organization, an international organization, is trying to address the global burden in cancer through advocacy, capacity building, and the convening of meetings. And Julie is the Director of Special Projects. Then we also have Jose Jeronimo, who is an adjunct faculty member at Duke. And previously he was working at PATH, where he led their cervical cancer prevention program. And he's a world-renowned expert in cervical cancer prevention. Thank you, Julie and Jose, for joining us today.
You're welcome.
Thank you.
So let me also add one more piece of information, which is how we all are connected. And of course, right now, we're all connected as a community contending with the COVID-19 virus. But Julie, Jose, Marley, and I are also part of a consortium called the Wish Revolution, Women-Inspired Strategies for Health, as a way to mitigate global cervical cancer mortality. And so we've been working together to come up with these strategies. And now I thought it would be really appropriate to have them talk about the work they're doing in the context of the current pandemic. So with that, I'd like to start and ask the first question, which is to both of you: how is COVID-19 affecting you personally? And also, what role, if any, are you playing professionally in activities related to COVID-19?
Shall I take that, Jose?
Yeah.
Well, I'm based in Geneva, Switzerland, and all of us are currently at home, pretty much in lockdown, with practicing social distancing, and have been for several weeks. From the perspective of our organisation, we've already decided that we will not travel for the rest of this year, that we will move our conference, which was planned for October, to March 2021. And we've already communicated that to our attendees and community. And we're keeping a close eye on obviously what's happening in the neighbouring countries like France and Italy, which is very important, particularly for Geneva, where we have close borders. So yes, on a personal level, I'm working from home, doing a lot more video conferencing, but maintaining a usual day of work and being able to continue to be connected to most of our membership around the world. UICC has over 1,000 members in 176 countries, and we are very much aware of the impact also on those membership organisations. So it's very much a focus for us in the next few months.
Hi, Nimmi. Well, I'm based in the Washington, D.C. area. The number of cases in this area is increasing every day. Working from home the last weeks, and I don't have any trip planned also for the rest of the year. I mean, who knows what's going to happen in the next month. I'm working very actively with the U.S. National Cancer Institute in several aspects of cancer prevention. Even though we are working from home, I'm busier than usual because there are so many things also happening related to cancer prevention in the COVID-19 era that we need to rethink a lot of the things that we are doing. I mean, it's a good time to work from home, but also it's busier for me.
So both of you work together in UICC. So can you tell me a little bit about your collaboration in the cancer control, cancer prevention space?
Julie?
Well, we've known each other personally, I think, ever since I started
Yeah.
at UICC, and that's 12 years. So I was a bit surprised where to start, really. We work very closely, particularly on the cervical cancer issues as advocates. Obviously, very much pushing the UN agencies and member states to really take full attention to the opportunity to prevent and control cervical cancer. But we also work on technical assistance and support in country. And we've collaborated in the past in a number of countries, particularly on developing guidelines and policy recommendations, particularly to include new screening modalities. And so the excitement now in the past couple of years is around the call to action from Dr. Tedros at WHO, really inspiring the world to the opportunity to eliminate cervical cancer. And of course, we have worked on several working groups alongside WHO and other partners, but really bringing also some of our grassroots members' views, and particularly women's views, to the discourse. And I think that's that's where we overlap particularly.
I want to highlight, I mean, I've been working with, collaborating with Julia and UICC in some of the efforts of the organization. I want to highlight that huge presence that UICC has around the world. I usually mention around 1,000 or so members around the world. And in my experience working in the field in Africa or Latin America, UICC has been always a great partner. We collaborated in several countries, actually multiple countries, having the presence of UICC, their network, and also all the programs that UICC runs and grants. They have some training grants, or they have advocacy experience, and that's huge.
Thank you.
Thank you. So we talked earlier about how COVID-19 is affecting cancer, because resources are obviously going towards this acute problem. Can you speak to specifically what kinds of services are being impacted and how you're thinking about the future of cancer control, prevention, management, as we sort of get to a steady state, or even consider the fact that we might be in a post-COVID-19 era?
Yeah, well, we know that this COVID-19 pandemic has affected most of the countries. The program for cervical cancer, all the cancer control is in many countries. Not only that, this has affected the treatment of patients with cancer. They really are very high risk. But also in this time, because we cannot do a lot of that activity for cancer prevention, I think the movement is toward the development of strategies that can be done in the field, in people's home, rather than in the clinics. And I think that's what some countries are already evaluating, how to take the tests to the women's or the families in their own homes, and just bring those who need care in the clinics. I think there is a process now to create new strategies. We know that countries are going to be economically affected. Really a huge impact in the economy of the countries. That also means that the programs or the strategy we create have to be more than affordable than ever now. Have to be something new, something innovative, and something that countries can afford in this time of crisis.
Yes, well, I mean, I think the first concern of our members, and of course anyone in the cancer community, is what's the indirect impact for cancer patients. We know that they are susceptible to infection through the underlying disease, but the question is, what other susceptibility might there be in the case of COVID-19, which is also currently unknown. The other challenge is, how to get the information out to, be able to care and look and support cancer patients, but also protect them from exposure. So UICC has collated information from the community. We have a resource portal, iccportal.org, where all the relevant information connecting cancer and COVID-19 is being shared. And we've had a series of webinars and will continue to do so to inform the community as more information comes out. But what we do know is clinical trials have stopped, research in the field has stopped, universities are no longer open, and so education has stopped. We know there has been significant changes into the approach of treating patients. New diagnoses are not happening. Treatment changes are happening, so elective surgery has been cancelled. Treatments are being adjusted to be as friendly to the situation as possible. And so many cancer patients sit in this situation of not knowing if they're getting the optimal treatment for them. And of course, they're having access challenges. They're not allowed to move around. They might not be able to access the clinic. We're also seeing staff changes in the clinic, either being diverted to acute stations, or just through infection themselves, or lack of movement themselves, that the clinics are also challenged there. So there's a lot of things happening at the moment, and one of the things that I think is important for the cancer community is just to understand what's the best way of dealing with this. If we do have good solutions, how can we share them? And as Jose said, and many of the higher income country settings are moving to tele services, so having one-to-ones like this with patients. And you do question, why couldn't we have done that before? And in fact, that might be a positive coming out of this experience, that might continue in some settings, which I think is very practical for patients.
Those are great points, because what you're saying is there's going to be some transformations in healthcare that might not have happened if we weren't sort of facing this crisis, right? Because there's inertia, and now we can overcome that inertia because we have to. You talked about the role of telemedicine. My husband's in fact trying to do that right now in the other room.
Excellent.
But nonetheless, patients actually appreciate it. They feel, that they can do things more efficiently. But I want to come back to this idea of bringing things to people's homes, but also the way decision-making is made. And Jose, I know you're working with NCI on these artificial intelligence algorithms as a way to automate cervical cancer diagnosis and screening, so that in places where there are limited experts, this can be an amazing way to both fill that gap, but also provide access to places and people who may not have a lot of experts to provide, services for them. Can you talk about that a little bit more, this whole idea of AI and how you see that fitting again in a post-COVID-19 era?
We have seen that artificial intelligence is getting more and more presence in medicine. We have seen that in the last 2 years. We have seen AI being more relevant, for example, in diagnosis of biopsies, in the reading of X-rays as well, the automatic reading of X-rays. And that's moving also to the field of diagnosis in different cancers, actually. And cervical cancer is one of them, because the advantage we have with cervical cancer prevention is that we have direct access, in some way direct access to the organ, to the cervix, using the speculum. But this artificial intelligence is also being evaluated in other cancers. Gastric cancer, colon cancer, is moving a lot on that direction. The idea with artificial intelligence is that the software is going to support the work of the health worker. We don't have highly trained health workers everywhere, and the workers we have in most of the countries in the field, they are responsible for multiple different tasks, not only for one task, not only for cervical cancer. And creating a tool like artificial intelligence to support the evaluation of that person in that field with very limited resources. That's what we are looking at. There are several groups working on that, and the collaboration is quite important at this time in order to speed this process up. I mean, I know Duke also working on that area as well, and Duke is collaborating with others in that specific area as well. I mean, that's the way to go, collaboration between different groups. And the WISH revolution is a great example. It's a consortium of people, organizations working together with the same goal. I think artificial intelligence is going to be much more prominent. Mm-hmm. And this collaboration we are having is going to facilitate the process.
Thank you. This is great. I really appreciate the time you took to talk about COVID-19, cancer, and the real potential for transformation through different health services, different types of health services that create more access. I mean, it's very disheartening that individuals that are marginalized and have already historically lacked access to care are going to be even in a more precarious position because of this. And so I guess my hope is that through the changes in the health system, we can actually create more equitable healthcare by creating new strategies that could reach more people. So that's exciting that there is a silver lining on the cloud, and there is a potential for more equitable health in the future. I was wondering if either of you have any additional thoughts to share. A lot of times we hear disheartening news from the media, and I think there's so much potential for knowledge exchange and building community through experts who share their perspectives. And I was just curious whether you had anything else that you would like to add or any thoughts that you'd like to share.
Well, I think what we do know, and reporting from many countries now, is that screening is pretty much ground to a halt. So what we do know from that is we will have people that will be diagnosed later, and we will also have a backlog of suspicious cases and patients that need to be managed. So one of the things we're trying to look at is how can we work with different countries to see how they are coping and get some good learning so that we can share not just in this acute phase at the moment, but also in the recovery phase. And the idea of people just going back to the normal services, I think we have to throw that away. I think people will be reluctant to potentially even go to a clinic because that's where a lot of this disease has been seen in the media. They might be concerned about going to screening campaigns because they know that coming together in big groups still might be a risk. But the positive, I think, is that the understanding through COVID that an infection can lead to severe illness and potentially death might open up the understanding of the linkage between the HPV infection and cervical cancer. So it might help with the dialogue. And I think the initiatives that Jose was talking about around artificial intelligence, around putting the woman in charge of her health, would maybe help overcome those barriers. So maybe the community is ready to accept some of these innovations much earlier and with more enthusiasm, because it's going to help us recover and build up those screening rates again. So I'm quite positive about the way things will go. Maybe just, if I can just share one of the initiatives that UICC is kicking off with many organizations around the world. We've established a COVID-19 and cancer task force. We will be sending out information early next week on how people can get involved in the modeling consortium that will be attached to that work. We're looking to really try and make the data work for us in this immediate phase, but also in the longer term. But we'll also be using the task force vehicle to collate data now and over a series of months to bring that data together and share that back out with the community to see how we can inform practice as we move forward. You know, where is the best place to invest those precious resources, because we know resources are going to be tight. Where's the best places to invest to recover services as quickly as possible? And of course, to use it as an advocacy platform. What we definitely notice is a lot of the discussions around COVID-19 are just about the evolution of the disease, the infection and the illness attached to it, without any impact on other health outcomes. And we know already that we're seeing a high incidence of people with NCDs, cancer and other non-communicable diseases, particularly having severe infections and dying from COVID-19. So we need to be on top of the data so that we can inform policymakers so they make the best decisions in this recovery period as well.
Thank you,
Yeah.
Julie.
As I mentioned, the COVID-19 has a huge impact in several aspects, and economic impact is one of them. But also the COVID-19 pandemic is creating awareness in the community. I mean, people are everywhere talking about the virus, the damage that the virus can produce in our body. Also, people are talking about new technologies, how to detect the virus, this COVID-19 virus, how molecular testing. That was something that you didn't hear in the community. Now you hear people talking about those things, and they talk about the need for new technologies to fight the virus. And that's something we have been doing for the last years. And that's the plan we have with the Wish Revolution as well, how to use the new technologies in molecular testing, in evaluation of the cervix, in visual assessment of the uterine cervix, and also how to predict what women are treatable or not treatable. I think all this work we have been doing in the last couple of years, at least, is much more relevant now because we can transfer some of the activity from the clinic to the community.
Great. Well, thank you both for taking the time to talk with me and our team. And I'm looking forward to many more productive conversations through our collaboration. And I just wanted to tell the listeners that if you have any questions for Julie or Jose, feel free to post comments after you hear this interview. Thank you, everyone, and take care.
Take care. Bye.